Chances are you know someone who lives with the tremors associated with Parkinson's disease or other medical conditions. Deep brain stimulation is a new procedure being used to treat movement disorders. To understand just how important DBS may be to those afflicted with tremors, let's meet Dan Stark and learn about his story.
A few years back, God's warranty on my health expired.
Dan Stark was in his early 40s when his health troubles began.
Understand that I had never been in the hospital, never missed a day of work, and had just completed my first century, 100-mile bike ride. So it seemed unfair that I tore a ligament in my knee playing tennis and required an operation. Okay, so you say, grin and bear it. I agree. But then that little twitching in my pinky and my left hand got annoying, so I limped off to the doctor. Parkinson's disease. Damn.
Parkinson's disease is a rare disorder of the central nervous system. It can produce gradual but progressive muscle rigidity, tremors, and difficulty in movement.
Parkinson's is caused by the loss of the brain cells which produce dopamine. Dopamine is one of those things that you've never heard of until you start missing it. In many ways, Parkinson's is like trying to run an engine without oil. When the body loses the dopamine, which is used by the brain to control the muscles, then it can't control the muscles, and they become rigid, they seize up. When I was first diagnosed with Parkinson's, though, I was much more optimistic. I assumed this was such a slow-moving disease that there was bound to be a cure well before I ever experienced the serious symptoms. That turned out not to be true.
To try to slow the progress of the disease, Dan participated in several clinical drug trials. An admitted workaholic, Dan was determined not to allow his Parkinson's to affect his work as a lawyer.
And that meant gradually escalating up the pharmacological curve. I started taking stronger and stronger drugs to deal with it. Most of the symptoms that people associate with Parkinson's are in fact the adverse consequences, the reactions to the drugs, the shaking, so forth. In my case, Parkinson's causes me to become rigid. The muscles tighten and they shorten, and as a result you get pain and it's difficult to move. The drugs fix that problem, but they also cause the shaking, the dyskinesia. That is the technical name. But the flounder flop is the typical Parkinson's shaking, the uncontrollable shaking of the legs or the arms where you really can't stop. And you flop around at its worst like a fish.
As hard as Parkinson's is on the body, it can be even harder on the mind.
The thing that I find scary, and most people find scary about Parkinson's, is that it is progressive. And that means that over time, your brain cells keep dying. They don't have a cure, and nothing is known that will slow it down or stop it. So over time, each day you wake up, you know it's going to be a little bit worse.
Eventually, Dan found himself taking nearly every drug that had been approved to treat Parkinson's. He was swallowing as many as 30 pills a day, and the medicine took its toll.
It hit me very hard because over-medication contributed to shaking, and I started feeling numbness in my hands, and I couldn't sleep. The reason I was over-medicating was because the medicine was working less effectively, which happens. But in November of that year, it hit me with a rush, and my life more or less fell apart. I really was near the end of my rope at that time, and that's a hard time to talk about. Let me just say I bounced back and started deciding I was going to fight the damn thing. I wasn't going to give in, and I've fought it ever since.
Dan learned of a relatively new surgical procedure known as deep brain stimulation, or DBS. DBS was devised as a way to disrupt the electrical impulses that cause tremors, requiring the insertion of electrodes into the brain.
It was a new procedure. I had not heard of it, frankly, and it promised benefits. Sounded very good, but it also sounded risky. It's brain surgery after all. I also did not like the fact about the surgery that you have to stay conscious, because during the surgery they want to ask you questions. They tamper with the settings and they say, what do you feel? I did not feel like going through 6 hours of surgery being awake, and I really was very nervous about that. 5% have bad effects. That doesn't mean you die. It means you die or have a stroke or have an infection. Infections in the brain are pretty nasty things.
Another consideration was that DBS doesn't cure Parkinson's. Rather, it's used in an effort to lessen the disease's debilitating effects. Dan hesitated for several months, researching DBS and weighing his options.
And then when the symptoms started getting bad, I was actually down in the Virgin Islands with my daughter on vacation, and I decided, this is too beautiful. There's too much nice stuff that I'd like to do. And so once again, I decided, roll the dice, see what happens. 5% sounds a lot when you're thinking about it in the wrong way. Would you draw a straw if it's, one black straw and 19 white ones, and the goal is to pull one of the white straws? I figured those were good odds.
Dan put his health and his hopes in the hands of a DBS surgical team. It was a momentous decision, one that many seniors may need to consider in the years ahead for the treatment of a variety of medical conditions.
I'd like to welcome Dr. Kelly Foote, who can describe the surgery that Dan Stark was preparing to undergo. Dr. Foote is the co-director of the University of Florida Movement Disorder Center. He holds a doctorate in medicine from the University of Utah and completed his general surgery internship and a residency in neurological surgery at the University of Florida. He is an expert in deep brain stimulation for Parkinson's disease and other disorders, stereotactic and functional neurosurgery, radiosurgery, and brain tumors. Welcome, Dr. Foote.
Thanks, Alexis.
I am just completely so unbelievably impressed by the surgery. I just, when I saw it, it really brought me to tears. I guess where I want to start is to talk a little bit about Parkinson's itself. There are about 750,000 Americans that are affected, is that right?
Somewhere around there. Some people round it off and say about 1 million in the United States.
They say about 1 million. Now, why does it, I understand also it affects, the average age is 62. Why is it mature adults that it affects more than anyone?
Well, Parkinson's disease is caused by a loss of a certain type of neurons in the brain. And after the age of 20, all of our brains are shrinking and we're losing neurons day by day. It's sort of a sad state of affairs. But obviously, the older you are, the more of those cells that you will have lost. And it turns out that if we lived long enough, all of us would eventually get Parkinson's disease.
Is that right?
Yeah.
I actually just read that about Alzheimer's. It's so interesting that if we lived longer than the average lifespan, or I guess longer than the, what is it, 120, the oldest person who has lived, and we lived longer, that we would actually contract all of these diseases. So Parkinson's is when your brain no longer, fights dopamine or brings dopamine into effect?
Well, these cells that you're losing are cells that produce dopamine.
Okay.
So dopamine is something that your brain needs to function properly. And once you lose enough of these cells, you start to develop the symptoms of Parkinson's disease.
Now, how do you diagnose Parkinson's in someone?
Mainly by the types of problems that they're having. There are some new, exciting ways to be more specific about the diagnosis with some fancy imaging studies, but most of the time, 99% of the time, the diagnosis is made clinically by, I'm going to give you a little medical student brief lecture here.
Okay, we're all lay people out here, so be careful with us.
Well, the Parkinson's disease, the way to think about it is that it's a trap. And, the general public thinks of Parkinson's as any tremor, you know, is thought of, oh, that person must have Parkinson's
Right.
disease. But tremor is one of the components commonly of Parkinson's disease. Actually, not always. You can have Parkinson's disease without a tremor. But why I say it's a trap is there are 4 sort of cardinal symptoms of Parkinson's disease, and that's a mnemonic to help remember it. So the T stands for tremor.
Okay.
The R stands for rigidity. You know, you get really stiff. The A stands for akinesia, which just means no movement, or bradykinesia, which is slow movement, so it really slows you down. And P stands for postural instability. So that's another part of Parkinson's disease that becomes very disabling after a while. You start falling down. So TRAP is typical of Parkinson's symptoms.
So a lot of it is that if I start to feel that I can't speak or that I'm having gait problems, walking problems, if I understand correctly, it's like a machine that hasn't been oiled.
Right. That's actually a good way to think about it. I've never thought of it that way. But you can't move the way you want to move.
I want to continue this. This is so interesting. In just 1 second. We need to take a brief break. When we return, we'll see a field segment of Dr. Foote and his surgical partner perform DBS surgery on a patient who suffers from tremors. Don't go away.
Do you know? Before Dr. James Parkinson's An Essay on the Shaking Palsy in 1817, who made the first known account of what we now call Parkinson's disease? Do you know the answer? Leonardo da Vinci, who wrote in the 15th century, "You will see those who move their trembling parts, such as their heads or hands, without permission of the soul. The soul, with all its forces, cannot prevent these parts from trembling."
We're back. We've been talking with Dr. Kelly Foote about a surgical procedure known as deep brain stimulation. In August 2006, Dr. Foote performed this procedure on Charles Craigie, who suffers from a tremor disorder. Let's see Charles Craigie's story and also find out the results of Dan Stark's DBS surgery.
Like Parkinson's sufferer Dan Stark, Charles Craigie of Live Oak, Florida, has made the decision to try deep brain stimulation, or DBS.
Well, this is a special day in my life because it's my birthday. I'm 74 years old today, and tomorrow is the biggest day. I'm going to have an operation. I'm so happy. I'm crying. I'm sorry.
Charles does not have Parkinson's disease. He has a different kind of movement disorder that has plagued him all his life.
I never thought I was going to make 74 years old. One thing, I never thought I'd make it because of the tremors I'm in. The tremors are really bad right now. I'm sorry.
Dr. Michael Oken, an expert on neurological problems at the University of Florida Movement Disorder Center, has been evaluating Charles to help him with his condition.
The patient had what we call an abnormal hyperkinetic or too much movement disorder, and we call it essential tremor. It's the most common tremor disorder that we see in medicine, and it's treatable both by medicines and by surgery. And so we've been following him in our Movement Disorder Center clinics. We've tried a number of the medications, and the medications don't seem to be helping him.
Yeah, eating, get it spilled all over the front of me. When I'm eating, I have to really watch myself well. But drinking, I have to put a straw in my bottle of water or glass, or have to hold it with 2 hands to get it up to my face. Cup of coffee, spill that all over myself every morning.
So we decided, along with him, that the next step for treatment of that tremor would be to insert a device we call a deep brain stimulator.
Like Dan Stark, Charles felt that DBS was worth the risk.
You don't even know what it's like to sit in front of people when we go to a theater at night, or a restaurant, and have people sit across from me and they watch me. People don't understand what tremors are.
At the Shands Hospital at the University of Florida, Dr. Michael Oken and Dr. Kelly Foote will perform DBS surgery on Charles Craigie. Charles will remain awake for the entire 4-hour procedure so that he can respond to the doctor's requests when necessary. After numbing Charles' head with anesthetics, neurosurgeon Kelly Foote and his team will delicately drill through Charles' skull and expose his brain. Once the drilling is done, Dr. Oken's role will begin.
Yesterday was your birthday, huh?
Yep.
Well, happy birthday.
Thank you, sir.
My job is what's called microelectrode recording. I eavesdrop on brain cells. They tell me a story, they sing me a song, and based on that information, we are able to put an electrode in and disrupt what is an abnormal circuit.
The hair-thin electrode is pushed into Charles' brain in increments of less than a millimeter.
We have impact here, just relax for me. Okay. The difference in the brain when you miss by a millimeter or two is like the difference between Florida and California.
As the surgery continues, Dr. Oken conducts a series of tremor tests to determine how the body and the different areas of the brain are responding.
Tremor cell. We like to know whether or not we see tremor at rest, when they're not doing anything, at posture, when they have their arms out in front of them or their arms held up in a posture or the fingers pointed toward each other, or at action, when they're doing finger-to-nose maneuvers, bringing a coffee cup up to their lips, doing spirals or handwriting tasks.
When the electrode is properly positioned, Charles' condition improves before the doctor's eyes.
Start right here.
You're asking for trouble.
Well, Dr. Foote wants to make sure you can sign that check to him.
For the first time in decades, he's able to sign his name legibly.
Let's see the first. Let's see the pre-op spiral.
Where's the pre-op? What do you think?
I think better.
You want that one?
Yeah.
All right, we'll go with that.
All right.
DBS has not cured Charles' condition, but it has opened a door for him to a more comfortable and manageable life.
I never thought I'd see the day.
Dan Stark used a different surgical team for the treatment of his Parkinson's symptoms. He too has found relief through DBS.
The DBS surgery has been a life-changing event for me. I am on such low doses of medication now that I don't get shakes in the evening anymore. In fact, now that the settings have been set very, very close to the ideal, I think, for me, I take hardly any drugs. And I can go about things that I used to love to do. I play piano, not well, but for my own entertainment and for the torture of the people around me. It really has restored my ability to enjoy myself.
Still with us to discuss the challenges and potential benefits of deep brain stimulation is Dr. Kelly Foote, co-director of the University of Florida's Movement Disorder Center. Dr. Foote, thank you for being here. Tell me a little bit more about deep brain stimulation. What is it exactly?
It's the implantation of an electrode array in the brain in a very specific location, as well as a generator that's connected to the electrode in the brain, and a cable that connects the two that goes under your skin, so it's all implanted inside the body.
Okay.
The generator is implanted here, and you can communicate with it through the skin to program it. And by delivering continuous stimulation to this malfunctioning circuit in the brain, we're able to interrupt pathological processes.
I was both anxious about it and excited about the fact that the patient is actually awake. Why do they need to be awake during the surgery?
Well, it's actually safer for the patient, first of all, to be awake. And more importantly, we are more effective at finding the exact right spot in the brain to stimulate. And if we test stimulate and the patient's awake, he can tell us, well, that's not right. Whatever you just did is not making me feel better.
Because it's very individual, right? For each
Right.
person, you're going to be able to touch a different part of their brain that's going to affect them differently. Is that correct?
Yeah, well, I mean, everyone has the same structures inside their brain, and we are aiming for a target that varies somewhat from individual to individual. But if we're a millimeter away from where we want to be, that could mean the difference between someone who has dramatically improved quality of life, and someone who wishes they had never met me.
Yeah,
Every time the simulator's turned on, they get some sort of side effect that they don't like.
Now, do they wish they had ever met you because they're in pain during the procedure, being awake at all? Are they in pain?
I hope not. No, it's not a painful procedure.
It's not.
There are no sensory nerve endings in the brain, so you can't feel anything when someone touches your brain.
I see. I know that I think it's 1 out of 20 people, there's a complication that happens. Why do those complications happen? Tell us a little bit about that part.
Well, probably the most common complication is infection. In surgery, anytime you cut someone's skin open, you interrupt their best protection against bacterial infection. So we know that if we do 100 operations and we do everything just right, 3 people are going to get an infection. If we implant something in the body, like screws or pins or rods or deep brain stimulators, that infection rate doubles.
Oh.
Even if we're doing everything right. So now, that's 1 out of 20 people are going to get an infection.
It seems to me that there are so many areas of the body that this could affect. I mean, you could stay there for 24 hours tweaking. How do you know when to stop the procedure?
Well, we have a lot of experience with these particular circuits in the brain, and we're looking for a profile when we test stimulate. We first, with the microelectrodes, we find the structure, we find the boundaries of the structure, we decide where we think is going to be the optimal place to put the electrode, we put it in, and then we turn it on and test it right there. And if we get what we expect to get when we turn it on and test it, then we're satisfied and we secure it in place.
Well, I think the results have been dramatic, and it's really exciting to see what's going to come in the future with this kind of knowledge and technology. Thank you so much for being here.
My pleasure.